So today the topic is looking at research in the field of complementary medicine. Now I'm joined today as usual by our beautiful, wonderful goddess of everything to do with membership, Roberta Macmillan. So hi Roberta.
Hi everyone. Hi.
Hi. And also our guest of honor today is my partner. It's Dr. Frank Sabatino. So Frank, please.
Good afternoon, everybody. Good afternoon from across the pond. Hello.
And the reason that we've got Frank with us today is not just because he's my honey, but also because he happens to be really quite good at research. Frank has not one but two doctorates, so you could just say he's greedy or just a ridiculous propeller head brain box, which is actually true. So Frank is very, very eminent within the field of complementary medicine, and you know, I think really, actually, Frank, it might be an idea. Could I possibly pass the buck to you and ask you to just give everybody, if you like, an intro to you and your background, so that they know, you know, where you're coming from, and probably why we should pay attention to you. I think that might be a good place to start.
Well, I always like to start with the idea that I've been a plant-based physician for over 40 years. So that's been a very big part of counseling people in terms of lifestyle and health. I was trained initially as a chiropractic physician at the Palmer College of Chiropractic in the United States, but I was very interested in what we're talking about today, which was research in the field. And I decided that I needed to get some other experience and credential to do that work. So I went back as a chiropractic physician to medical school. I went to the Emory University School of Medicine, where I got a master's and a PhD in neurobiology, cell biology, and neuroendocrinology, and spent about 10 years of my life in really hardcore scientific research, both at Emory and then as a professor at the University of Texas in San Antonio, that at the time had the largest aging research center in the world. This was in the late 1980s and early 90s. So I took that experience into my practice, which has been in residential lifestyle modification and teaching for a good 30, 40 years. So today, I want to bring that kind of experience in a very practical way, because this was my dance too. I wanted to be able to do research in alternative medical practice. And so being able to attach to an organization like Janie's, which is probably one of the premier organizations in the world for really looking at the evidence base in complementary medicine. So I'm so happy to be part of this organization, to be part of, as a research director of this organization, and to contribute to what I do, what I can do to help spread the idea of how we can get more of an evidence base out for all the wonderful and beautiful things we do as alternative medical practitioners. So that's really a short synopsis of where I'm coming from. And I hope that we can have a dialogue and share some of that experience today.
Thanks, Frank. That's fantastic. And I should explain to everybody that what's going on today isn't sheer nepotism. The funny thing is that what actually happened was that way many years before I actually even had come across Frank in the real world, ironically, because as you know, part and parcel of the work that I do, aside from heading up the CMA and founding the CMA, is that I'm fascinated by anti-aging, you could say gerontology, and the other thing is that I'm completely fascinated by immunology as well, and all of this, and of course plant-based living and so on and so forth, all kind of comes hand in hand, and also is kind of dictated by my own devastating health experiences and, you know, illness experiences and so on. So the interesting thing about this connection is that I had actually been referencing Frank's research papers, Sabatino, FD, for many, many years, because his work, he's far too modest to tell you, but his work is actually incredibly well thought of. And researchers to this day still actually reference the papers, Sabatino, FD, that he pioneered, the work that he pioneered way back when, because that work still stands. So it's a really strange thing, because then when we were set up on a sort of essentially a blind date, it took some time for the penny to drop for me that this was the guy I've been referencing all those years. So we're not just doing sheer nepotism here. Frank actually legitimately has a place at the table, because his understanding of research in our field is absolutely outstanding. And so we are very lucky to actually be able to have him on side with us in complementary medicine. Now, as you know, one of the accusations in the field of complementary medicine is very much that there's no research. You know, a lot of the skeptics, as you know, there are these dyed-in-the-wool skeptics who are in fact, and it is a matter of public record, are in fact paid shills for the pharmaceutical industry. They will often say, well, your field is fraught with great big holes from a research perspective, you know, you know, the data just don't exist. And the problem is that I think in complementary medicine, so many of us have heard that. And because these are professors like Professor Edzard Ernst and Professor David Colquhoun and Dr. Simon Singh and all these supposedly eminent people commentating on our field, when they actually have absolutely no bloody right to commentate on our field. They're not body workers. They are not doctors. They've never sat in front of a client and held that client's hand and looked them in the eyes and understood what suffering genuinely is. So these are people who have this vested interest in supporting the pharmaceutical industry. I may come on to the reasons why and the attack on this field through the use of the Advertising Standards Authority and so on and so forth. I may come on to that later if we have time. But I do want you to know that when I talk about skeptics, I'm not talking from a conspiracy theory perspective, but what I do say to you is based on public knowledge. And in America, Frank, you have precisely the same situation, don't you? You have an awful lot of good doctors constantly under attack.
Yeah, and it's true. But the point you make is so important. There are a lot of data that are collected in alternative medical practice that can shed light in a tremendous way on the benefits of what we all do, whether it's chiropractic or homeopathy or massage or reflexology or acupuncture. The problem that has occurred is that many times people don't know the nuts and bolts of how to do research, how to pose a question that's a pointed question, and then to actually have confidence in the fact that the thing that you're trying to test, whatever that treatment is, whatever that therapy is actually producing the results that you're hoping to see. So the problem always comes down to how can you establish a protocol, no matter what you do, because it doesn't change whether you're doing some rigorous, biological animal-based research or you're investigating something that seems to be more tangential or alternative. There are still certain steps that have to be done to ensure the confidence in the results that you're getting as they relate to the question that you're asking. And I hope today we can unravel that and make that a little clearer for people so that in their own practices, in their own field, if they want to start looking at questions in a more scientific research manner, they have some nuts and bolts, some basic steps of how you look at that, how you do that to make it an effective outcome. Because a lot of it then becomes what scientists always like to brush off as just being anecdotal. There's no real relationship to what you are doing and what you're saying the outcome is of what you're doing. So how can you and how can the community of people looking at what you do have more confidence in the fact that you are actually creating the results that you think you're getting? That's always the crux of all scientific inquiry. They talk about confidence limits. They talk about all it really means is, are the data you're generating really in a way exemplifying the question that you're asking and the treatment that you're doing. It comes down to the same no matter what the research question is, no matter how sophisticated or how simple.
Thanks, Frank. That is really important. A couple of things come up for me there. So when the skeptics talk about there being no research in the field, and we know that's not the case, and I'll come on to that in a minute, but the other problem is with the field is that a lot of the time I see eminent people within our field saying, well, you know, the field that we work in actually can't be researched because we're dealing with such holistic issues. So for example, that you can't successfully run double-blind random controlled trials, which used to be considered the gold standard for evidence-based medicine. But actually, Frank's going to come on to a couple of trial examples that were published in major medical journals not so long ago, which were not RCTs. And in actual fact, it's really important for everybody to know that we are actually able to stand up and be counted with things like outcome studies. Now, there have been some major, huge homeopathy studies, for example, where they measured the outcome. And similarly, there have been incredibly well-structured individualized homeopathy studies that, for example, one published back in October 2020 on the outcome of individualized homeopathy in random controlled trials on patients, the quality of life of patients with stage 4 non-small cell lung cancers. So, you know, so it just goes to show that when we ourselves say, oh, but our field can't be researched, we're actually incorrect. It can be researched, but it comes down to people with a very refined understanding of how to set up trials that actually produce meaningful data. For example, people like Frank, who understand how to construct trials, you know, by virtue of his background and training. Would you go along with that, Frank?
Yeah, I think at this juncture, would it be useful to outline the way studies are constructed simply? So people, when they look at data, they have an understanding of how it was kind of set up, because it's made to be complicated, but it's really not. And I think if we can simplify the way something is structured, it doesn't matter then how abstract your treatment is. Are you able to use some objective, acceptable tool or instrument to measure that outcome? Because if you can, it doesn't really matter how abstract your methodology may be, because you still have an objective way to look at outcome. Your point of outcome is so important. So, you know, you talked about, you know, for most people, the gold standard of research has always been randomized controlled studies or trials that are double blinded. And all that means is that you have people that have, let's say, similar characteristics, groups, two separate groups. One would be a control group, a group that's not going to be affected by what you do, and another group that's going to be subjected to your treatment, whether it's homeopathy, chiropractic, whatever. And then you have to take these people so that you eliminate a bunch of variables. So for example, they may be matched by an age range or by gender. Let's just take that to be simple. So we know people in a certain age range and a certain gender, male or female, will be in two groups. But what's going to happen is you have a population of those people matched for age and gender, and you randomly assign them to these separate groups. So there's no bias in how you chose the people that went into these groups. So they call that a random assessment, because you're randomly assigning people to two separate groups. One would be the control, which was basically the group that you're doing nothing to. And one would be the experimental group that would then be subjected to reflexology or homeopathy or some acupuncture treatment. And so then what you do is now you're going to select something as a question that you want to look at. You may decide, for example, you published this beautiful article on homeopathy in the Journal of Oncology that looked at survival rates of people with cancer. or the one that was done on reflexology with pain. So those are very cool studies, because what the people were done, they were randomly assigned to either a control group or an experimental group. The treatment was provided, okay, to the experimental group, but here's the key. You needed an objective measurement that you could all come together to agree upon, and that is irrefutable in the scientific community. So for example, in the reflexology study, they used a pain instrument, a questionnaire called the VAS analysis. And people need to know that no matter what you're doing, there are all of these objective instruments that exist. So you have, for example, instruments that will measure depression that are accepted in the field, or anxiety or pain. So the question then is, how do you link an objective tool, a measuring tool, to your alternative medical approach? Because on some level, you have to have an objective way to evaluate what you're doing. You just can't say, well, it looked like Mr. Jones and Mr. Tom had less pain. You can say that, and it's not that it's not valuable, because clinically it's an observable fact. But you have to, if you're going to be able to have a real evidence base, there has to be some objective tool that can be brought into your evaluation. So so you have this randomized study, you have an objective tool, and you have a question. Does this therapy create less pain or better quality of life? Or does it improve some blood test that you want to look at? Or does it reduce inflammation? Whatever your question is becomes your kind of hypothesis that you're going into this research with. And you're saying, for example, yeah, homeopathy reduces pain or reduces inflammatory situations in my population. So the question then is, it's a great question, but you have to have an objective way to measure that outcome. So I want to impart to people that you can randomly assign groups. That's one, that's always the gold standard. And double blind just means that the people doing the research and the people receiving the treatment, neither of them know who's getting that intervention. So for example, the classic one would be, let's say, with some vitamin or some drug treatment, or even a homeopathic prep. A double blind would be that Janie, who's giving these clients this treatment, this homeopathic treatment, there's going to be a certain number of people that actually get the treatment, and there's going to be a certain number of people that don't. They may get a sham or a placebo. So for example, they may get water given to them, or a tablet that contains none of the dilution or none of the homeopathic prep. So the bottom line is, the researchers and the people receiving the treatment don't know what's going on, but there is an organizing body that organized that research that know who's getting what. So that's called a double blind, because both people don't know.
Okay, so can I just at this point in the group, because we've got a size of group where we can actually unmute ourselves, and if we have any questions, and so I encourage you to do that. Has anybody actually in the group undertaken any form of research study at this point in time, or are you intending to? Where are we at with research right now? Yes, please, if you want to just chime in, just unmute yourself and speak. Yes, thanks.
Hi, Jenny.
Hi.
This is Bruna. I have carried out researches in the past as an educator. I did it when I did my degree in education, and then when I became a teacher, then I qualified to teach adults. So when I was listening to Dr. Sabatino talking, it sounds very familiar, it's very exciting. I love research, I'm very academic. So when he was talking, I could feel my blood really, the energy, because it's something that I'm very, very passionate about, because it's true. I mean, I believe that some people, some people still think that alternative medicine or complementary medicine is the old wife tale, which is not the case. There's lots of research that individual people have put together. So I'm actually quite excited, and I was thinking that that's somewhere where I want to move into. So I'm familiar with the question, with the objectivity that you have to have when you research, the analyzing the data, to choose the correct way to collect the data, because then there could be interviewing clients, there could be, so there is a lot of research that you have to be careful. I don't know what are the ethical guidelines. So for education, there is a body called the BERA, B-E-R-A, where you have all the guidelines that you must meet for your research to be acceptable. I am not aware for the complementary for complementary medicine, where is the document? Because you have to be sure, I totally agree, you need to be sure that what you say can be backed up. There is a lot out there, but the advantage of the CMA, that there are enough people that you can gather the information together, and then you can actually produce a longitudinal studies where you can answer many questions, but again, the question has to be relevant. So it's something that I'm going to stop, because I really love the field, I really love research, and I will be talking forever. But it's something that I really have been looking into, and I wanted to do something similar in complementary medicine.
Fantastic, Bruno, thank you.
It is really interesting, and it's needed.
Yeah, most definitely it is needed, absolutely. Just one thing at this point, I thank you very much, Bruno, that's absolutely fantastic. One of the things at this point, when Frank was talking about random controlled trials, and I'll just say this part, and then I think somebody else had their hand up saying that they've been doing some research as well. But something I just want to point out to you is this book. I don't know if you can see it the right way around. It's called Complementary and Alternative Health, the Scientific Verdict on What Really Works. And you can see the CMA logo up the top there. This is, I call it my big fat encyclopedia. It is a great big weighty tome. This book I did for Collins, and I was the editor-in-chief, because my job, and this was back in 2010, that I actually pulled all of this, these data together. What I had to do to create this book was that I had to trawl through over 10,000 random controlled trials. And the reason I had to do random controlled trials for this book was because that's the briefing of Collins. That's what they wanted. I would have put in outcome studies. I'd have put in all sorts of other things as well, had it been in my brief. I wasn't being paid to do that, so I didn't do it. But, you know, back in 2010, there were over 10,000 relevant RCTs in the field at that time that I could include in that book. And my job was to anglicize those trials, because in the Lancet, for example, and also the British Medical Journal, there have been articles of late that have shown that doctors, medical doctors themselves, actually don't read trials. They don't read journal articles, published in the big journals and so on. They don't have time. And also because doctors have not been trained as scientists to understand what these articles actually mean. So they will read the intro and they will skip straight to the conclusions. And the problem is many of these trials are set up by drug companies, and the actual methodology and the actual outcomes are completely different to what is claimed in the conclusions. So the doctors are skipping over all of the actual meaningful, relevant data and just going straight to the conclusions, going, oh yeah, well, that drug clearly works. Next. And so, you know, that's a big worry to me. And so that's why I had to, if you like, anglicize these trials into English so they would be understandable by a lay reader, and also, of course, by doctors as well, who need to understand the evidence base for complementary medicine. So when people say the evidence doesn't exist, well, it really, really does. But Bruno, you know, I take your point when you say that within the Complementary Medical Association, we actually are very privileged in that we have huge pools of practitioners and huge pools of patients that we could potentially use and enroll on trials if we decide to start to go that way. And certainly in complementary medicine, MIMOPS is a very, very good research methodology that does work brilliantly in our field. Now, so sorry, carry on, Frank.
Can I follow through on one point?
Sure.
Because I was trying to make a point with double blinds that that's not necessarily the way you have to go. I was making the point that many times they see that as a gold standard, but most of the studies that are very effective are what are called single blind studies, where the investigator knows that they're giving a certain treatment, whether it's reflexology or whatever, but because you establish an effective placebo input in your study, the client that's receiving the treatment doesn't necessarily know that they're getting that particular treatment. And the best studies that are done have to build that in. And I want the people out there to understand that the reason that's built in is because one of the things that most people attack research for is the placebo effect. Meaning when you touch somebody, if you're a therapist, and I touch somebody, there can be an impact on that can create remarkable benefits while not being singularly related to the treatment that I'm doing. So the bottom line is, how can you rule out an effect that's not directly addressing the question you're trying to ask? Meaning, does reflexology reduce pain? Does chiropractic reduce pain? So you have to have a way that when you set up a study, if you're going to do it, yes, you have a huge body in the CMA, which means that you can gather data that increases your sample size. And we always know in research, the more sample you have, the more confident you are that the results you're seeing can be actually spoken of that way. But the other thing is you have to rule out is that if you have a control group, you have to have some way to build in a placebo component so that you can look at control, placebo, and then the experimental group. It's very important to realize that people can do this very simple treatment where I do a treatment, I gather data from a population of people I'm working on, or you gather huge numbers from the CMA. And then what you do is then you can look at the outcome more effectively by having bigger numbers. And you don't have to do randomized control. You don't have to do double blind, but you do have to set up a good control group, a placebo group, and an experimental group. And as we go on, I'll give you an example from the chiropractic profession, how one of the biggest studies done built that in so people will understand that more effectively. But right now we can address the people that are with questions or whatever.
Yeah. One of the things I just want to say actually is that one of the problems in our field and that we are often browbeaten with by the skeptics is the fact that when you get any type of meta-analysis, so a meta-analysis is where researchers, for example, one of the groups that does this and was always held to be the gold standard until they had all sorts of naughty things going on behind the scenes, was the Cochrane Collaboration. I'm sure many of you will have come across Cochrane and heard about them. Well, anyway, so Cochrane, the problem with Cochrane was that they would look at, for example, research in the field of homeopathy and say, well, the problem is from our perspective, homeopathy doesn't work because we can't find sufficient numbers of trials that are actually well-constructed RCTs with a large enough sample size. So they would therefore chuck all of those studies out, regardless of actually genuinely how well they were constructed. So, and the problem is in conventional medicine, you can have some trials with very, very small sample sizes, and they're looked upon as pilot trials. And then Cochrane will turn around and say, oh, yes, we'll include those. Those are okay. So they cherry pick. This is what we're against in complementary medicine. They cherry pick, and the skeptics do this. They say, oh, well, clearly nothing works in complementary medicine because, this trial and this trial and this trial, these 6 trials showed that nothing happened, or that the patients had a negative outcome. Whereas had they actually, if they were more honest, if they were more scientifically honest, which of course is not what they're paid to be, then they would actually, a very different picture would emerge. So let me just ask you, before we crack on, and I know we've got questions coming up in the sidebar, in the chat bar, I will come on to some of those because some of those do bear coming back to in a bit, which would be fantastic if you can bear with us for that. I just wanted to say, I know that we saw a couple of other hands coming up. Who else has done or been involved in research? Yes, come, Joanna, would you like to, you've unmuted yourself. Yes,
I unmuted myself. Hi, Jenny.
Hi.
Hi, Frank. Hi, everyone.
So yes, I'm halfway through writing my PhD proposal. I have a supervisor,
God bless
and
you.
that's it. And I've kind of yes, I've written lots of info, and now we're down to the methodology, and I'm now waiting to hear back from him to make sure I'm on the right track, because I do therapeutic sound in schools with special needs children, and so my research, I'd like to bring in the parents, the staff, and the children I work with to get data for the adults. So measuring subjective well-being, but using physiological data as well. So having like a well-being scale, but also triangulating it with maybe a galvanic skin response, I was thinking, or don't know, kind of.
Have you thought about things like salivary cortisol, for example, pre and post?
Yes, my supervisor, so I'm kind of crossing the bridge between the music and the education department. And his last bit of research was using amylase as a marker. He's not so keen on cortisol, and is kind of trying to steer me away from it. And he's saying there's too many variables with the saliva. So again, I'd love to look at the hormonal response, because my sort of theory behind it is looking through the lens of the polyvagal theory, which is if we can manage our nervous system, then all the behaviors that we're trying to instill in the children will kind of happen anyway, because they're actually in that sort of calm space rather than in their fight or flight. So yes, if there's any kind of research around the use of hormonal markers, I would be very happy to read them.
Frank, I think that's really your ballpark, isn't it?
What she's doing is fantastic, and it brings up a very interesting point for me. Sometimes you will set up a research design like she's doing, and the truth of the matter is, the more focused the question is, the easier it is to test that hypothesis. And it tends to create a more robust outcome in terms of the effectiveness, the efficacy of that study. But what's intriguing is like what she's doing. If you wanted to do cortisol profiles like salivary hormonal evaluation, which you could do, you can do testing where you look at a 24 cycle with cortisol. It's easily done in saliva. But sometimes when you set up a study like she's doing, sometimes when you get into the data, you can start to tease out other relationships, and that's often what's done. If you look at a big epidemiological study like EPIC Oxford, or you look at the work that Colin Campbell did with the China study, they start out looking for certain things, maybe something related to cancer. But then it's very intriguing is that they can tease that data, and now they have information on osteoporosis and heart disease. And so what she's doing, while it sounds more global, if she can narrow down a certain particular outcome you're really looking for and focus on that, it will make that initial study robust, but it also will lay the groundwork for actually finding things out that we never even thought to ask. And that's the kind of intriguing thing about science, because as you do that dance, you get involved in discovery often of things that no one else has ever seen before. That was the real excitement for me. But I think with this population of children and people, there's a lot of moving parts in what she's doing. There's a lot of variables in that, and that makes it a little bit more difficult and a little bit more difficult to discuss. But if she uses the proper instruments like she's doing, things that can effectively measure outcome, then you can gather specific data to address the initial hypothesis, the question, but it may allow you to tease out so many other very important pieces. And that'll happen for all the alternative practitioners if they do that. They must start out looking at something, but then some other quality of life issue may come up. And if it's set up the right way, it's amazing the kind of information you can gather.
Brilliant, Frank. Thank you very, very much. Just before we move on, I just wanted to also say that we've got a few representatives from other organisations within the complementary medical field joining us today. So thank you for being with us. It's absolutely wonderful. So what Bruno was saying earlier about the CMA having a really great big, you know, obviously loads and loads of practitioners, but also a huge field of potential people to use for trials. Using trials sounds awful. It sounds I'm turning them into sort of like objects or guinea pigs. I don't mean it to come across like that. What I mean is we have potentially good sample sizes of people, real people. But so thank you so much for joining us, everybody from other organizations. Now, has anybody else?
A simple idea, let me just say for 1 second, because I don't want it to get lost. When you are dealing with practice and you are providing alternative medical practice, whether it's chiropractic, whatever you're doing, there's a very subjective component to that. If you want to research a subjective input, you have to have a very objective way to evaluate it. And I want people to understand that relationship of subjective to objective. I think it's not complicated, but it's so important because it will come back to haunt you in the field of anybody looking at what you do if there's not an objective evaluation of your subjective input. And I just want to share that. And the way you construct your little research project, whatever it may be, can really make your subjective input and what it does much more robust by having a very effective objective way to evaluate it. And I think there are many of those tools available that many of us are not aware of. Tools that measure pain and measure subjective things like happiness or depression or anxiety. There are actually really good instruments for that, good questionnaire instruments, good tools that are not complicated to use and manipulate. And I'm urging the people in this organization and in this field to investigate that, and we can maybe make some of those instruments available to them, to where to go research them, so that they can bring them into their offices and into their private practices. And it would really start to expand the objective evaluation of alternative medical practice.
It's interesting because some of these tools that you're talking about, Frank, for example, something I'm very familiar with being tested on constantly are my pain scores. So as I'm sure all of you know, I have rheumatoid arthritis. So whenever I go and see my rheumatologist, I am enrolled in various trials. And so for that, he has to, every time I see him, he actually has to check my pain scores. Now, these are these are an observation and also a patient reported set of data. So, you know, it's very, very simple. It doesn't have to be rocket science. It can just be as simple as we all agree on a score or a set of questions, and then we measure against that set of questions. So it's all actually incredibly easy and incredibly simple, much less complicated than most people even can begin to think research in this field is. Who else has been doing in research? Anybody is doing research? Anybody actually wanting to do research? Unmute yourselves and let us know. Okay, so nobody at the moment. All right, that's fine, jolly good. Okay, lovely. So we've got some questions here, and if you bear with me, I'm going to have a quick look at the sidebar here. And if you think of any questions, either do feel free to ask them, unmute yourselves by all means, or just leave me a message. Right, okay, so Sharon says, I work as a homeopath and intolerance tester. How do I find out what research has been done or published so that I can create Facebook posts and mail shots and so on? Sharon, did you see this week's CMA newsletter? You can unmute yourself if you...
Hello.
Hi, I'm trying to find... Oh, there you are, Sharon. Hello. So I've got gallery view, so I can see everybody simultaneously. There you are, Sharon. Hi. Hello. Yes.
Hello.
Did you see the newsletter this week? Lovely.
I did, yes. It was very, very exciting about the homeopathy one with the cancer. Very exciting.
Okay, yeah. And obviously the reflexology, and we had an acupuncture one as well. So where did we get those from? We got those from PubMed. So I don't know if you're familiar with PubMed. I mean, clearly, of course, you know, we have within the CMA newsletter every week, we try to bring you the most up-to-date, latest breaking research studies right across the field of complementary medicine and natural health care. We sometimes bring you conventional medical studies if it sort of impacts our field. You know, we have to pick and choose as best we can. What I wanted to say was that you are all of you are more than welcome to say, for example, and somebody else did this, they emailed me and they very kindly said, Janie, in fact, actually it was Jackie, wasn't it? Yes, Jackie, we were speaking, and Jackie and I were having a chat and saying, you know, what can we do to support each other's organisations? Jackie's from the GNC, and you know, one of the things we said was, gosh, you've got some really great research on your site, and you've got some really good research on your site. Can we maybe share each other's research data? And of course, obviously, because it's really important to credit where you get this information from, you've got to say where you got it from and make a link back to the website, to the web page that you got the data from. So you don't even have to start playing around with PubMed, although I do encourage everybody, if you are interested in looking at research, for example, you could go into PubMed, which is actually, it's an online publication from the USA's National Institute of Health, the NIH, and they've got this repository of every research, sort of bioscience research, dating back to probably the 1930s, if they've been able to actually capture any of that research. So it makes the most incredible, mind-blowing resource of organizations. So I'd always say PubMed. Also, the Complementary Medical Association has just become a corporate member of the Research Council for Complementary Medicine. It's quite funny because we've been involved with them since the get-go. I remember speaking to them back in the mid-1990s when I first founded the CMA, and wanted to get involved with them then. It wasn't, they were good, but I think they too were sort of more or less in their infancy, and so we did a little bit with them then, and then we kind of wandered off on our route that we've been going through, growing the organization. I mean, it's kind of come back full circle now, because they are doing brilliant work in the field of supporting research. They've even got bursaries for researchers, so if you are looking at doing research in the field, it is definitely worth having a look at their site and maybe having a look at some of the bursaries and so on that they're offering researchers who are interested in growing the database, the information base in this, and the knowledge base in this field. So that's another place that you could go to. Let's have a little further look. So yes, Sharon, so I hope that's helpful. Does that help? Yeah, great, thank you. Thumbs up. I like a thumbs up. Bruna said she'd be really interested in being part of a group of researchers. Your academic brain is firing up already. That's brilliant. Yeah, absolutely fantastic. Yes, so we'd love to have you. Right, Roberta's just asked me, is this big book, the big fat encyclopedia, Complementary and Alternative Health, the Scientific Verdict on What Really Works, this one, gosh, I had to yomp down the road. I did my beach walk. I was walking on the shingle this morning with this and my homemade soup in my backpack. Honestly, it was like doing a route march. It was hilarious. I was on the beach and I was kind of like trudging along. But, you know, as you all know, my Facebook group, Rewind Your Body Clock, we're all doing this daily walk together. So I was really making sure I got my exercise in. I've got some more books to talk to you about, research books as well here, which I'll come on to in a bit. But yeah, the big book is still available. Technically, it's out of print because it was 2010, I think, when it came out. But actually, you can still get it on Amazon. So, and it's really, you can usually get it really inexpensively. So why don't you, you know, if you're interested, you know, obviously the studies still hold water, but of course it was 2010. So other studies have come up since then. But what is good about this book is that there is a brilliant, if I do, it sounds very arrogant to say, I don't mean it to sound arrogant, but there is a very, very good drug herb supplement interaction database in the back of the book. Now, that was I found one of the most exciting tasks of pulling all this data together. However, of course, again, it really dealt with medicines that were only available at that particular time. So, for example, Viagra wasn't even invented then. So there have been these other inventions that have come along since then. Roberta, I see you with your hand up.
Thank you, Jenny. Yes, could you read out the title of the book, please?
Yes, thank you.
Someone wants.
Yes, of course, my darling. It's Complementary, it's got a shiny cover, Complementary and Alternative Health. And then the subtitle is The Scientific Verdict on What Really Works. And that was published by Collins. But if you just put in the title, you'll find it.
Thank you.
Okay, thank you very much. Right, okay, back to the questions. Oh, yes. Right, so Joanna says, thank you, Jenny and Frank. Is it possible to keep in contact in regard to the research you're doing? Yes, Joanna, of course, absolutely. Frank, are you happy? I don't want to speak on your behalf.
Well, no, what I was going to tell people is that in my position with this organization, I'm more than happy to be someone, if you have a research project or a design that you want us to look at, I would be more than happy to give my opinion on ways to make that even more robust if that was possible, or to give you any insight that I can. So I feel that I'm a resource for the entire membership, for anybody that wants to do any kind of research, that I'm here, and I'm very willing and happy to give whatever insight or input I can to improve the quality of what you're researching.
Thank you, Frank. That is fantastic. The other thing, Frank, I don't know whether this is something else that you might possibly be able to help with, because I think one of the things that stymies research and actually stops us before we go that really important next step is where, you know, if we want to take our studies on further and we want to do a PhD, for example,
right.
One of the things is actually creating that research question, and then making sure that your application is robust enough to actually, you know, for it to actually be accepted by a mentor or a tutor or a you know, some whatever. Different universities call them different things. Some, you know, a supervisor, for example. And so I think that tends to put people off from the very get-go, because you just think, well, who am I to actually be able to have this thought that I'm looking at something that nobody else has looked at ever in the history of woman or mankind. And I think that can actually be incredibly intimidating. And I think that's one of the things that stops people in their tracks. You know, I myself, I was asked by, when I finished my MSc, my supervisor came back to me, she said, sign up quickly to do your professional doctorate, because I don't know if you guys know, but a professional doctorate and a PhD are the equivalent. They're exactly the same thing, but a PhD is for academia, a professional doctorate is for people who are working and can use their work to actually create the sort of the research and the database and do all the work they need to do their doctorate. So the university that I did my master's at was the University of Central Lancashire. Now, the reason I chose them was because they are really one of the world's leading facilities for being able to do things online, which is brilliant if you are out there in the workforce, which is what applies to all of us, really, as we sit here. We're all, you know, got our practices. We can't just up sticks and spend the next, you know, 3 to 5 years going and you know, in the dusty hallows of some university somewhere. So you know, UCLan, as they're called, University of Central Lancashire, are well worth looking at if you are considering doing postgraduate work. And as I say, Frank, I don't know whether it's something that you could possibly, maybe it might be that the opportunity to talk about how to create a robust enough question, and then how to make that approach perhaps for a different, we won't do it today because it's a long topic, but maybe a different tutorial at some point. How do you feel about that?
Yeah, just briefly, you got to remember, and this is something that everybody can do. It doesn't take a scientist, but remember, the science itself is based on probability. It's not based on infallibility. And what I mean by that is, when you do a study, there's going to be a result of what you do. The question is is the probability of that result more than just being random? Is it something that is actually occurring because of what you're doing? That's really the crux of science, because they actually establish what they call fundamentally the null hypothesis. For example, you would say homeopathy does nothing to improve cancer outcome. Let's just say that. That would be the null hypothesis. But behind that, what you're investigating is the fact that, yes, I believe homeopathy does improve cancer outcome. So now you do, and you give your sample size, the therapy that you're doing, you create a control that doesn't receive it. And then now you're going to compare that question, that outcome, in this case, cancer survival, let's say, in both groups. And the truth of the matter is, you have to show that in the group that received that homeopathy, that result was so improbable, if the null hypothesis existed, that no one can refute that that outcome occurred by homeopathy. That's the crux of all science. It is basically saying that my result is not occurring at random. It is actually a direct result of what I'm doing. Now, it's never going to be perfect. So what scientists do is they do a statistical evaluation where they create a value of probability, and they call it a p-value. If you ever look at a study, you'll see someone will report a p-value. P just means, what is the probability that the outcome that I saw, that I measured, that occurred because of what I did, is actually occurring because of what I did? And there is a way to evaluate that statistically. And I'll urge you to, and I'll tell you this, that most places that do research, the people doing the research don't do the statistics. So I'm telling you, don't do this at home. Get somebody, there's programs for that, there's people that do that, but at some level, you have to show that the probability, the outcome that you got, that the probability is there that shows it was related to what you do. If you can't show that, you will always have somebody refuting that outcome. It will not be robust. So in answer to Janie's question is, can you create a very pointed study? Because sometimes what happens for people when they start out, and this happened to me, and I had to learn this myself over many years, you start out with very big global questions because you know you're so passionate about what you do. You're so passionate about your therapy and the things you want to do to help people that you create very big global. And I'm going to tell you that the bigger that is, the more variables there are and the less robust it will be. That person who was doing research with the children, yeah, you may say, does this affect cortisol levels in this population? That would be a very specific question. It would be a much better question that could lead to a more robust outcome because it's more focused. And the hardest thing when people first do research is to focus the question. And then the second hardest thing is what are the objective ways that you're going to, deal with the answers to your question? So the thing is setting up a focused question, finding the right ways to measure what you're asking, and then the rest of that just takes care of itself, because the rest of that is just statistically evaluating the numbers and the outcome. But you do have to establish a question. You do have to show that there's a significant probability that what you did created that outcome, and then you have to statistically show that that's true. And it's not infallible, but there has to be a confidence that it is more than just random. And that's what all science is about. How do you create that confidence? Because then you've got a robust outcome. I hope that was clear to people.
Yeah, that's absolutely fantastic. Thank you. Yes, question.
Yes, I found that really interesting, Frank. And I just wondered if I could, I'm a registered homeopath and registered craniosacral therapist. I did a BSc in homeopathy, and we did part of what we had to do as a research proposition. So it took me down a fantastic path of all the research, but I have pulled away from the idea of, in my practice, to ever do research, although I'm trustee on the Craniosacral Therapy Association, and we have paid for research. But my question to you is, well, two questions really. With what we all do for a living, it's quite difficult to narrow it down to, and that sample benefited regarding their symptoms for this form of therapy in isolation to anything else that they may have been doing, you know, whether they meditated as well. And my second question, if you do have the answer, is what about sample size? Because obviously if we're looking at something that's never been done before, might have a sample size of about 5, or you know, if it's a certain niche autoimmune condition, finding enough people. But what stage with complementary medicine do you feel it needs to have a big enough sample size?
They're incredible questions, and that sample size has always been the knock on human research, because when you do animal research, they have a in-house population of animals, which unfortunately get too abused sometimes in these research projects. But because humans have more variables, as you say, it becomes harder, and it's always made it more suspect. That's why people have looked at kind of focused populations over time, where that population became its own test group in an epidemiological way. So whether it's EPIC, Oxford, which has 65,000 people monitored over the past 30 years, they're looked at, or Framingham in the United States, they have an in-population community that they can select and rule at, you know, they can select for age, gender, or whatever. And then they can look, for example, at, let's say, eating habits, but not only in that time, monitoring the same people over those habits. So that's how they improve that outcome. But it's interesting to say that you can do, for example, I have a good friend, Dr. Alan Goldhammer, who runs a fasting institution in the United States. They had 1 or 2 cases of in remarkable shrinkage of lymphoma as a result of water-only fasting. And it's very intriguing that Nature actually published a 1 or 2 person result, because the fact is they did it very conscientiously. They evaluated the data. This person was in residence, so they could see all the variables that were involved. And the fact of the matter is they made a case for this single therapeutic input and this outcome of shrinkage, which was then measured by medical physicians and so on. Now, obviously a 1-person study is not going to create a robust thing, but it is a pilot approach to leading into, hey, that's something that's worth investigating. This was such a dramatic result compared to what was happening before. So even with a few people, even with less numbers, you can still create valid outcome studies that would need to be then maybe fleshed out by more expansive studies. And this is where a group like the CMA is useful, because you can pool data from a variety of practitioners that could actually increase sample size. And your point is well made. The larger the sample, the greater is, the more confidence you can have that the outcome is a more robust outcome that you're seeing. Because the less people, that makes the probability less intense, less robust. But it doesn't make it non-robust. It makes it something that may still be worth looking at. And now it becomes another avenue to open up an avenue of discussion that you may attract all kinds of people wanting to address that question. So I tell people, you know, if you do it right and you use proper instruments to evaluate, you can selectively reduce some of the variables, but in office practice, it is harder because they leave you. If you have residential practice, like some of these people do with fasting centers, they have a captive audience for a period of time. In a private practice, you don't have that as much, but you can still use objective measurements that are showing outcome, and that still would be valuable. But your point is very well made. We do need to expand sample size, but by having an organization with all these remarkable practitioners, there can be a call to action where now people doing individual data work can pool that data, and now you've expanded that base to make that outcome even more robust in discussion. Does that make sense what I'm saying?
That's wonderful. Yes, thank you.
Okay.
I do also want to say thank you very much, Amal, for that question. And it's lovely to put a face to the name after all these years. Yeah, I do actually want to say that the Complementary Medical Association is also working with other organisations. There are a few initiatives at the moment which we've been working on for many, many years behind the scenes. And the reason we don't tell you about them is not because it's a great big secret, because it isn't, but it's because we don't want to talk about launching something until we're really ready to launch it. And so one of the initiatives at the moment is where we're working on an initiative called the Hawthorne Project, and Hawthorne Initiative actually, and that's Balan's and Rob the Kirk and his crew and various others. Now the idea is that we will bring organisations together so that we have not just the CMA but other organisations as well, all feeding into this, so that again we can actually start to create bigger cohorts and also run things like outcome studies as well. So it's all happening there. But at this point, I think what we want to do is I'm going to give you another couple of books that I have found immensely helpful in learning about research. This one is by the doyenne, I think, of research herself, Judith Bell. It's actually called Doing Your Research Project. Can you see that one there? That's, yeah, everybody's nodding. I'm sure many of you have got this. This is Judith Bell. So whichever stage you're at with doing your research project, whether you are just simply wanting to do research because it's interesting for you, or whether you're right up at PhD or further stage, that book is invaluable. So I would strongly suggest looking up that. And then another one for really getting your head around the whole thorny issue of what actually constitutes science is this one. It's Chalmers, and this is a really popular book in the field. It's called What Is This Thing Called Science? And it says, I'll read you a little bit on the back here. Again, this is one of the cornerstones for any researcher. Over the last 25 years, this account of modern scientific attempts to dethrone empiricist thought has become both a bestseller and a standard university text with translations into 15 languages. So anyway, this is make sure you get a revised version because there are so many versions of this. And then my absolute all-time favorite book ever is this one, The Structure of Scientific Revolution. And this is so important for us as complementary medical practitioners by Kuhn. This text is the ultimate text for any researcher. I'm not sure, Frank, did you ever read that?
That was one of the most important books I've ever read related to science. Actually.
Yeah, absolutely. It truly is.
On paradigm shifts, setting up paradigm, all of it. It's just an amazing book. Yeah. It's worth people's time and effort for sure.
It sure is. Yeah, out of all of those two, I'd say if you've got time to read a book, read The Structure of Scientific Revolutions, because what Kuhn did in this book is that, he talks about, as Frank just said, paradigm shift. And it really helps us as complementary medical practitioners to actually get our heads around why the attacks on complementary medicine are so incredibly vicious, why we get the death threats, why we get all these awful things, because at the end of any sort of paradigm, so for example, Newtonian physics and the way that Descartes divided the body into its individual pieces and separated the mind from the body and so on and so forth, where that is all changing. You've got the old guard, the Colquhouns, the Ernsts, the Simon Sings, and all the rest of them. And you're getting the last gasp of their paradigm as they know that their reductionist paradigm is really dying. And so what happens in a beast that's dying, it fights for its life, doesn't it? So it's like having a cornered rat. And what happens is it will attack viciously in order to try to save itself. And we are at, it's a little bit to get woo about it. We can talk about the age of Aquarius and so on and so forth. Things are changing. Things are dramatically changing in the world. We are starting to see, for example, somebody approached me the other day saying, Janie, do you want to do a PhD in psychedelic research? And I thought, I could do that. I've got, you know, I do know what I want to do, and I've got to pick my battles, because, you know, you're not going to start doing two PhDs simultaneously. And I've gone quite a long way down the road with UCLan, with the Prof Doc. And I've got to find the time and space to actually start doing it. But, you know, just the very fact, I mean, this would have been unheard of. Last year, it would have been unheard of that somebody, a doctor, a really respected doctor, research, brilliant doctor and professor in the field of psychology, positive psychology research, would actually approach somebody and say, would you like to do a PhD in psychotropics and psychedelics? Just as brazen as you like. And as you know, I mean, obviously we've got, you know, the University of Greenwich leading the field in this, and Imperial College leading the field in this field, in this sector, as well as of course Berkeley in the USA. So it's just interesting. And the reason I bring this up is because it illustrates the paradigm shift is real. Really, we are the vanguard of a really new set of developments. And the fact we're having this discussion today about research in our field and how we can really take things forward, I think is highly telling. So thank you. Any other questions? I know we've got some notes, and so I'll come back to the notes in a second. Any other questions at the moment? Or should I just get on with, right, let me get on with the notes. And if you think of anything, just chime in, okay? So, Wendy says, having a robust objective input certainly makes sense, but the issue is finding out about the tools available. Would be helpful to know where to start. Interested in what Frank said about this. I'd love to do research on the impact of EMET in the reduction of pain, but finding it very difficult to take out the subjectivity. Very much a novice when it comes to research. Again, as Frank said, Wendy, it's all about finding out what the question is that you want to ask, and then figuring out how to ask it, of course. But go back to this week's CMA newsletter and take a look at the reflexology that was used on the operating theatre nurses. Now, they had back pain, unsurprisingly, because they're on their feet all day. And of course, they're leaning over patients and so on. So unsurprisingly, this is what they're presenting with. So they managed to tease out the confounding factors, and they managed to create a trial that really did actually genuinely work. I forget whether they were using reflexology and sham reflexology. I feel they must have been.
No, they didn't do a sham. So
what did they do, Frank?
They did just an outcome study, meaning they did the therapy, did the pain measure, and that's all, and that's really good. But the robust nature, because anytime you're doing subjective therapy, placebo effects are incredibly high. And that's what makes hardcore scientists want to attack you. Let me give you, can I give one example of a design? I'll do it very briefly, because I know people are busy too. In the chiropractic profession, there was an input where the question was posed that chiropractic care would improve people's ability to resolve hardcore addiction. And there were addiction centers in South Florida here in the United States. And the gold standard for evaluating whether something is successfully helping addicts is, does it help them stay in treatment when they enter a rehab facility? It's called retention rate. So the gold standard is, does this, because what happens is if you're withdrawing from drugs, let's say, there's so much pain that typically when people enter a rehab facility, over 90% leave in a matter of days because it hurts, and they know if they use, they're going to feel okay. So one of the standards is, can we keep them in treatment so that they can resolve this? The people that stay longer in care do better. So retention rate in the care system is one of the ways they measure it. So they wanted to see if chiropractic care could help retention rate. And so what they had to do now, understand that when you do chiropractic care, that can be very subjective. The individual doctors may have different force and different ways that they're applying this and that. So it's very hard to rule that out. So understand this, I'm going to show you something. This instrument was created just for that particular study. It's called an integrator. And what it does, it provides a force of the same force and the same frequency, no matter who delivers that force. So they were able to create a uniform application that would be involved in putting input into the nervous system. And then what they did is they set this instrument to provide no force, but to just make that same clicking sound when it was applied to the body. So they created a placebo group that got the clicking sound. They got a test group that got the clicking sound, but that was delivered with force and frequency, which they didn't know they were getting. So they built in this nicer way to make a uniform chiropractic adjustment regardless of who gave it. And they were able to create a very uniform, clear placebo group. And they found that the impact of chiropractic care improved the retention rate from 3% to 97%. So they were able to get a very clear outcome, but in that case, they created a very clean placebo group and a very clean and robust way to uniform the chiropractic adjustment. I only lay that out because it gives you an idea that if you're going to set up a design, those are the kinds of things you need to think about. How can you remove the subjective placebo effects more effectively so that what you're seeing is a robust response to what you're really trying to test and what you're really doing. And so I hope that just that little encapsulation gives you an idea of how that design makes things more robust.
That is absolutely fantastic. Thank you. I think that's a really brilliant. It's nothing quite like show and tell, is there? I think that's a brilliant example. Thank you so much, Frank. Right. Okay. I realized I can't believe where the time's gone. I apologize.
Already over an hour. I can't believe it.
I know. It's flown by. Frank, have you got to run?
No, I'm okay right now.
Okay, all right. Well, let me just go through the final questions and then, okay. Oh, Tricia says she just managed to find the book on Amazon. Excellent, well done, good. I hope you like it. I'm happy to answer any questions because, as I say, it's a bit out of date, so if there's anything you want to comment on or explain further, I'm more than happy to. It was only £4, so it's worth it, you know, it's a good book to have. Right, okay, Christine says, what I find really frustrating is that when I was at uni doing my bachelor's, we had full access to research via journals. Aha, I see where you're going here. Now it's a case of having to pay for PubMed, Science Direct as access to all of those full papers.
Tell them about SciNet, Jenny.
Frank, I was coming on to that. I was thinking, shall we? Okay, right, okay, and then there's a similar question. Let me just finish off the questions first. Do you know if there's an alternative to paying extensive fees? Then Catherine says, if you become a member of the Royal Society of Medicine, you get free access to a large library of journals, etc. Membership isn't cheap though, and I felt it's still valuable to have access resources. Yeah, okay, yes, you do. That's true. If you're a member of the RSM, that's fine. However, we've just discovered recently that there is a pirate site for research papers. It's called, is it SciNet? SCI? It's SCI-net, isn't it, Frank?
Yes. Okay,
yeah, SciNet. So if you guys want to toddle off and have a little look at that, what happens is that you grab the URL of the research paper you're interested in looking at, and you put that into the search bar on SciNet, and voila, as if by magic, you may well find that your study comes up. Now, because it's pirate, and it's completely naughty to be doing this, you may find sometimes that your paper's there or it may not be there, so it's not fail-safe. And if you want to be completely legitimate, then yes, the Royal Society of Medicine is a very, very good resource for, you know, their library's excellent. But if you want to just check something out briefly, even if you decide that you want to check it out slightly before buying it, you could do that as well. Then you could look at SciNet. I sort of feel as though we're a bit naughty telling you about that, but you know, it's out there on the internet. You could have found it even if we hadn't told you about it. So I hope that's helpful. Any other questions before we love you and leave you today? No? Okay.
Can I make a final
Please,
statement?
Frank, final statement, and then we'll wrap it up.
Before I jump in the pond? Yes.
Yes.
Alternative medical practitioners, like all the people in this organization, are incredibly near and dear to my heart. And what you are doing is connected to jewels and gems of discovery within your work that is absolutely untapped. And it will be the foundation for a remarkable scientific revolution. And you need to know that's within your reach and within your grasp. And one of the reasons why I love the CMA is that it is at the vanguard of protecting and supporting and promoting all of that. And I just want you to know that as a research consultant for the organization, that I'm absolutely here for you in any way that I can help, in any of your design and any of the ways you're trying to structure the work that you're doing to really ask the profound questions that we need answered. So just know that I'm here, that we're here, and I'm just grateful to be part of all of that. Thank you.
Oh, Frank, thank you, Frank. It's absolutely amazing. Truly, truly appreciate it, because I know that you are incredibly busy. Bruno very carefully, very cleverly noticed that you're wearing your CMA t-shirt. So extra brownie.
I always have the merch on, baby. That's where it's at, you know. I love these shirts. I just love them. So, you know.
Yeah. If anybody, if I was going to say, got to give a plug to the shop now, because yes, there is a CMA shop. We'll put some. What I was going to say actually was just briefly in closing, I'll put the names of those books for you on the CMA Facebook page, okay, so you can easily find them there. We'll also let you know where the shop is, because everybody loves all the bits and pieces. We've got some really fun bits and really nice bits in the shop. Frank, oh yes, could we share the link to SciNet? sci.net, you've not found it yet. Let me just try and get it up on my...
Make sure that's correct again, so.
Yeah. Oh, by the way, everybody, sorry, there's another book as well. This is the other one. I haven't bought it in. I've got it somewhere, but I couldn't find it for you. It's called How to Read a Paper, and that's by Trish Greenhow. Trish Greenhow is the really the leading light in evidence-based medicine. She is the woman that basically created it, and it's not kind of as anti-complementary medicine as you might think. So How to Read a Paper is an absolute gem. So again, if you're a researcher, or if you're interested in doing research, or you just want to go and play on SciNet, which we'll find for you in just a sec. I know that Roberta's looking for it at the moment. You know, if you get How to Read a Paper, let's just have a little look at that. Let me see, how much is that one? How to Read a Paper. Various people selling it. Kindle edition. Oh, actually, I've already bought it. It's on my Kindle. Let me find out how much it costs in the real world. Yeah, it's expensive. It's £25, but you can get that's new, and that's from Prime, so you can get it cheaper from other sellers as well, of course. So yeah, Roberta, have you been able to find SciNet yet? Lovely.
Could it possibly be Sci-Hub?
Oh, could it be Sci-Hub? Frank and I have been talking about SciNet. Chances are we possibly got it wrong.
That heading is Sci-Hub, removing barriers in the way of
That's
science.
The one. Thank you. Thank you. Thank you. Thank you. Right. I've been talking about it, and we've just been using the wrong terms. I do apologise. Thanks,
so
Roberta.
It is sci-hub.se. Would that be correct?
sci-hub.se.
.se, yes.
Just a second. Let's have a little look, shall we? Yes, that's it. That's the one. Yeah. Perfect. Yes, that's the one. So sci.hub.se. Thank you, Roberta. Once again, Roberta Macmillan saves the day. As always, you superstar, Roberta. And as you know, everybody, I just want to thank Roberta again, because you know, this is technically Roberta's day off, and she comes in and helps out in this group and lends her wisdom and helps us find things and does all sorts of magical things that we wouldn't be able to do without her. So Roberta, again, thank you.
It's truly absolutely my pleasure.
Oh, you're so lovely. Thank you. I just want to say thank you ever so much for everybody. Christine says, thank you very much. This is a great highlight to lockdown. Thank you. Oh, that's absolutely lovely. I'm so glad. I do hope this has been a useful session for you, everybody. You've got some really lovely positive comments there, which is always good, because, you know, we like to know that we're bringing things to you that are useful and relevant. Nobody wants to waste your time with things that are neither useful nor relevant. So, you know, I'm really glad. Oh, Cochrane says, brilliant as always. Thank you so much, Valerie. Great. that makes it all worthwhile. Thank you very, very much for that feedback. So yeah, have a lovely weekend, everybody. Thank you so much. Frank, you've been such a star. So appreciate it.
Thank you very much. My pleasure. My pleasure. Thank you.
Really generous of you to share your time with us. Okay. All right, lovely. Take care. All the very best to you. Lots of love. All the best. Have a great weekend. Take care. Bye.